Welcome to Sudden Illness Part 1. In this presentation, we're going to address the recognition of and the first aid for heart attack, angina, stroke, and respiratory difficulty. Heart attack is caused by a sudden reduction of blood flow to the heart muscle. This can arise from many different sources, but usually comes from plaque that builds up on the inside of the coronary arteries that then narrows the artery itself, the tube that the blood runs through. Unfortunately, for some folks, the first sign can be cardiac arrest. They can quite literally just drop dead. And every once in a while in the media, you hear of incidents where a person was minding their own business or giving a speech in front of someone when they suddenly just drop dead. And many times, not all the time, this can be a heart attack, and that would be the first sign. And unfortunately, it can occur at any age. I've said it in class before, with the American diet of red meat and donuts, there's a good chance that someone can have a heart attack at any age. So, how do we avoid having one? Well, don't smoke. Any of you guys that are smoking, just stop. And try to eat a healthy diet, maintain a normal weight, exercise, and as much as possible, control stress. So let's talk about what we look for in a heart attack victim. What are the signs? Well, unfortunately, the symptoms can vary. They don't have to be textbook. They don't have to be that one thing, chest pain, that you've heard of, that you know, yep, that sounds like a heart attack. It doesn't have to just be that. And as I said before, sometimes there are no signs at all, and then the person simply collapses. Although that's fairly rare. I would bet that if you had the chance to ask them, they would say that they were working through some sort of symptom, such as chest pain or jaw pain or arm pain. We'll talk more about those here in a moment. You see, mild symptoms can go on for 2 to 3 days, and the person will just keep coming to work. They'll keep working through the symptoms. They'll try to ignore it. They'll deny they're having a heart attack. And in fact, oftentimes, denying that you're having a heart attack can actually be the primary symptom of having a heart attack. So, classically, the things you think of, what are we looking for in a heart attack victim? Well, just what you've probably always heard of. A pain in the jaw, neck, arms, the shoulder, or back. Some people will call it a pressure type pain or a squeezing, or they'll describe it like there's an elephant sitting on their chest. Other folks can discuss it or describe it as being a sharp stabbing or burning pain. Along with this, and then especially with women, can also be feelings that are just vague. This little cartoon guy here, the third one over, who's got the little curly Q above his head, that's much more indicative of what females usually complain of, which is just a vague feeling of just not feeling well. They may complain of nausea. They may be sitting doing almost nothing and having a cold sweat, or perhaps feeling faint. Now, men can do this as well, but men are more apt to have the classical signs: chest pressure, the pain in the arm, shoulder, or back. And then everyone also can have shortness of breath. And again, if you find a person who has these warning signs, act fast. Call 911 immediately, even if the victim tells you not to. As I said, one of the primary signs or symptoms of heart attack can be that the person denies that they're having one and will tell you to go away, leave them alone. That's the single worst thing you could do. Try to convince the victim to sit down. Make them as comfortable as they can. Most of them are going to want to sit up in a chair or on a bed, on the tailgate of the truck, whatever it is, but make them as comfortable as possible. Loosen tight clothing. Make it easy for them to breathe. Get them air. Make sure that people aren't huddled around them. That can increase their stress level and just make it more difficult. Ask the victim if they have any medication with them for chest pain. The classic one that everybody thinks of is nitroglycerin. Some folks who have a history of chest pain, a past history of chest pain, may have nitroglycerin with them. And you should ask. It might be in their lunchbox, or if you're at a house, it might be in their medicine cabinet. A lot of folks who have these kinds of histories will carry the medication with them in their pocket. If it's available, you should have the victim chew 1 regular adult or 2 baby aspirin and then swallow. And yes, it is important that they chew them because that puts the aspirin into the bloodstream more quickly. And when we say a regular adult aspirin, what we want to avoid are coated aspirin. They usually have an orange, perhaps a brown coating on them to make them easier to swallow. We don't want to use those. We want to use good old-fashioned white aspirin tablet. As far as the baby aspirin are concerned, obviously those are designated to be chewable, and they're usually a little better tolerated. Yeah, absolutely, positively. Chewing up an aspirin and swallowing it is a pretty hard thing to do. They're very bitter. But it's important that they chew it and swallow. It's going to be said in your book, and I'm going to say it here also, that you should give a potential heart attack victim nothing to eat or drink. But I have to admit that a few minutes after they've chewed the aspirin, they've got that bitter taste in their mouth, I don't think a sip of water is going to hurt them too much. So giving them a sip of water would be fine so they can kind of, well, quite frankly, be a little more comfortable. And finally, stay with the victim. And if one's available, have someone get the first aid kit and the AED. This can be a dangerous situation, and if the AED is right there next to the person, so much the better. Do not attach the AED to a person who is awake and talking to you. It should only be applied to a person who is unconscious and unresponsive. Along with heart attack is angina, or sometimes it's called angina. This is chest pain that's usually caused by exertion. So on a job site, a person's doing a hard job and then suddenly complains of chest pain. But this only lasts for a few minutes. And the victim, if they have a history, may have medication with them, such as nitroglycerin. The person should stop working and sit down and rest and basically treat them just like you were going to treat a heart attack patient or victim. The bottom line is that this person's going to look at you and say, yeah, every once in a while I have chest pain when I'm really working hard. But if that chest pain does not go away within 10 minutes, call 911 and treat them just like you would a heart attack victim. The next condition we're going to talk about is stroke. Now, what's interesting is that stroke is very similar to heart attack, except it affects a different organ system. Instead of the heart having an interruption of blood flow, this time it's part of the brain. And while in heart attack, you can have heart attacks at almost any age group, stroke is most definitely more common in older adults, although in my own professional practice, I have responded to a stroke in a person as young as 19 years of age. But that was a military recruit who was under extraordinary physical pressure for the first time in his life, and he happened to have a stroke while he was in training. The signs of a stroke are primarily sudden weakness or numbness on one side of the body. So if you hear one side of the body is having difficulty, the first thing that should go through your mind is that the person is having a stroke. Next would be difficulty in speaking, especially slurring of the speech, and sometimes stroke signs can be confused for intoxication. The person may also have trouble in walking. Not being able to walk in a straight line. So again, very much kind of sounds like intoxication again. Then less common, but very important, are severe headache, vomiting, and loss of consciousness. These are the signs of a very severe stroke called a hemorrhagic stroke, which only accounts for about 15% of all the strokes that occur. Most strokes are what are called ischemic strokes. There's an interruption of blood flow that causes oxygen not to get to one part of the brain. Luckily, 85% of all strokes are those, because if we can get to these people having these ischemic strokes fast enough, and when we say fast enough, we usually mean within about 2 to 3 hours, we actually have medications that can be administered in the emergency room or in the hospital that can actually reverse a stroke. It doesn't always, but at least 85% of stroke victims have the chance of getting that medication. Whereas in a hemorrhagic stroke, there's actually a bursting of a blood vessel that then causes bleeding and doesn't allow blood to get to brain tissue and causes the stroke. And in these cases, this is where we see these sorts of signs and symptoms. The severe sudden headache. They're called thunderclap headaches. They come on all at once. And then those are usually accompanied by vomiting and then potential loss of consciousness. Again, you would call 911, no doubt, for the loss of consciousness. But also remember that these other signs can come along with it. So here's a graphic to remind you what those signs are that you're looking for. This comes from the Minnesota Stroke Association. You're looking for facial weakness on one side. That's what the little guy showing his uneven mouth there. Arm weakness, where one side of their body, if you ask them to hold their arms out, they can only hold one of them out for any period of time. And then any sort of speech difficulty. If they start sounding like they're talking out of their head, they look at you and they say milkshake or something like that. While that might sound funny, it's real. So don't think that it's funny. Think that there's a potential for stroke. Make note of the last time you saw the person normal, when they were completely well, because that's going to give us an indication of how long the signs and symptoms have been going on and whether or not we're in our 2 to 3 hour window for the medication. And remember, call 911. Just as we say that time is muscle in cardiac emergencies, in stroke, time is brain loss. Your first aid? Call 911, no doubt. Place the victim in a position of comfort and keep their head at least slightly elevated. If they want to lay down, and some folks will because they'll feel dizzy potentially, at least keep their head slightly elevated. Certainly don't let it allow it to be the lowest part of the body as they're laying down. If the victim does become unconscious, place them in the recovery position so that they can many times they'll have airway difficulties, and we want to make sure that any sort of mouth secretions or anything or vomitus is drained away from the airway. And finally, and your book really doesn't emphasize this too much, you need to reassure the victim. Talk to them, and talk to them normally. Even if they can't talk to you coherently, there's a good chance that they are perceiving their environment, where they are, correctly. So don't say, oh man, I really think he's going to die, or things like that, because more than likely, even though the person may not be able to express that they understand you, they have a good chance that they can. So be calm, reassure the victim, and talk to them while you're waiting for the paramedics or the emergency responders to arrive. Finally, we're going to talk about respiratory distress. And respiratory distress has many causes, and your book goes into some of those in great detail. But what I want to emphasize to you is that there's always the possibility of a medical emergency when a person has sudden, unexplained respiratory distress. And this is particularly important in children and infants. Quick action is crucial. We didn't go over children and infant CPR in our course. We went over what you'd need in your workplace, which was what we're here for. But the number one cause of cardiac arrest in children and infants is respiratory distress. Unlike adults, we just talked about how the very first sign of some heart attacks is that they drop dead. That's pretty uncommon in children and infants because they don't have decades of red meat and Krispy Kremes in their systems. Their hearts tend to be healthy. So it's usually a respiratory problem that then proceeds to go down the path towards cardiac arrest in infants and children. So if you see respiratory distress in an infant or child, getting them to a healthcare provider is very important if it doesn't resolve quickly. So what are we looking for? We're looking for a victim who's gasping or unable to catch their breath. They speak in short sentences. They can't talk very long without taking another breath. And as you can tell there, you can suddenly hear me breathing, which you really can't do while I'm talking to you as part of this lecture. Their breathing rate can be slow, fast, shallow, or deep, or any combination. Although obviously slow, fast, they can't be at the same time, and shallow, deep, they can't be at the same time. Although shallow and deep can be something that they do go back and forth with. Finally, breathing is noisy. So you put together fast or slow, shallow or deep, and then noisy. And as I just demonstrated to you, somebody who's having real difficulty in breathing, you can hear them breathing. Think about in our classroom. There are almost 24 of us in that room. Can we hear any of us breathing? No, because normal breathing is not noisy. And then finally, the victim may be lightheaded or dizzy. And sorry, that's not finally. Absolutely final would be that the person has pale or ashen skin. And when we talk about ashen skin, I'll remind you of the color of the walls in our classroom. Again, that kind of pale beige color is what we talk about in ashen, maybe even trending towards blue. So your first aid for respiratory distress is to call 911, and you should do that anytime someone has sudden unexplained breathing problems. Place the patient in a position of comfort. Most folks having difficulty in breathing do not want to lay on their backs. They want to sit up. Try to calm the victim and ask them to slow their breathing down if they're breathing really fast. That never helps very much. And most times, if you can calm the victim down, just reducing their respiratory rate can help. If the person has a history of some sort, go ahead and ask them, or if they say, hey, I've got an inhaler in my lunchbox or whatever it is, have someone go and get their medication if there is medication available. Or if you don't have to go too far away from the victim, go ahead and get it yourself. While calling 911 for sudden unexplained breathing problems is important, just as we said in angina, there can be folks who will have sudden difficulty in breathing who can look you straight in the face and say, yeah, I know what's going on. I have asthma or I have emphysema. Hey, would you give me a hand? Go get my lunchbox. My inhaler's in there. And that would be a perfectly good reason why you might not call 911 immediately. Well, that's the end of our lecture on sudden illness, part 1. We'll have part 2 coming up soon. Thanks for your attention.